Welcome, everyone, and thank you for joining NCBA today for a webinar on atherosclerotic cardiovascular disease in older Black and African Americans, an overview. And thank you to Amgen for sponsoring this webinar. Our presenter today is Kim Johnson, MD. Dr. Kim M. Johnson is a family physician and the president of Center for Racial Health Equity, a nonprofit organization committed to eliminating health inequities and improving health outcomes for persons of color. Dr. Johnson works to advance health equity using innovative strategies that leverage emerging and best practices in public health, healthcare, and social justice. A skilled strategist, trainer, and speaker, Dr. Johnson is committed to increasing community investment for better health outcomes, improving access and quality of care, and driving equitable development within communities of color to improve systems and cross-sector collaboration among stakeholders who share responsibility for achieving health equity. Dr. Johnson completed her undergrad at the University of Virginia, her medical degree with the Medical College of Virginia, and she did her residency in family medicine. Thank you for joining us, Dr. Johnson. We appreciate it. The floor is yours.
Thank you so much, Ms. Angela, and thank you to the National Caucus and Center on Black Aging. It's indeed a pleasure to be here this afternoon. We're going to just do a brief overview on atherosclerotic cardiovascular disease in older Black and African Americans. First slide, Angela. So today, we're going to cover a few topics related to atherosclerotic cardiovascular disease, and the acronym for that is ASCVD. So I won't be saying that long-term anymore, I'll just use the acronym. Today, we're going to cover topics such as what is ASCVD, what are some of the risk factors associated with ASCVD, as well as how are you tested for it, how do you lower your risk for ASCVD, as well as how do you work with your clinicians to manage ASCVD, and what are some things that are important to discuss with your doctor about ASCVD and assessing your risk. Next slide. So ASCVD is the cardiovascular disease overall, is the leading cause of death of African Americans in the United States. And so ASCVD in particular is a group of diseases that involves the buildup of plaque along the arterial walls, such as, and it leads to diseases or conditions such as coronary heart disease, which would include things like heart attacks or chest pain or angina or coronary artery stenosis. This plaque buildup also leads to peripheral artery disease. And so with that would be diseases or conditions like claudication, as well as cerebral vascular disease, which leads to things like transient ischemic attacks or TIAs and strokes, as well as aortic disease, which definitely leads to aortic aneurysms. So this is a whole set of diseases, or conditions, all caused by this buildup of plaque in your coronary arteries. We'll have a picture of that in the next slide, please. So here's just a picture or an animation of atherosclerosis, or the buildup of plaque in coronary arteries. On the left, what you'll see is a normal artery. And for this sake, it's a coronary artery. You can see the arrow flowing through, indicating that the blood flow through the artery is normal because there's nothing blocking it. There's nothing impeding it. And the size of that artery is normal. But look on the right, shows a picture or depicts the narrowing of an artery. And you can see at the bottom a thick layer of deposit, which is called a plaque. And so this plaque is usually made up of cholesterol and calcium over that accrues or just sort of builds up over time, and it causes this big plaque. This plaque, as you can see, narrows the opening or impedes the flow of blood through that artery. And when this happens, your heart then doesn't receive proper levels of oxygen, and it can lead to quite a few conditions that we named in the first slide. It can lead to heart attacks, it can lead to strokes, it can lead to peripheral artery disease, and a host of other conditions. So it's very much linked to atherosclerosis, or the buildup of plaque in the lining of, in this instance, your coronary arteries. Next slide, please. So there are quite a few risk factors associated with ASCVD, and many of these risk factors kind of play together in the same sandbox, meaning they in turn make each other worse or exacerbate each other, unfortunately. And the first of which is high blood pressure, which unfortunately is quite common in the Black and African American populations, both in older Americans as well as middle-aged, and even in some young Americans as well. High blood pressure is fairly common in the Black population, unfortunately. And what happens is when you have high blood pressure, especially over a long period of time, that high blood pressure damages the walls of your arteries. And that damage then allows the plaque to build up that we saw in the picture before. The same thing occurs in the second risk factor, diabetes. Like high blood pressure, diabetes is quite common in the Black and African American populations, as well as in young, middle-aged, and older populations as well in our community. Unfortunately, the high levels of blood sugar can damage the inner layers of your arteries, and that too causes plaque buildup. Of course, it would stand to reason that high cholesterol and high triglycerides, or what we call metabolic syndrome, actually too increase your risk for ASCVD, because as I explained, that plaque is made up of calcium as well as cholesterol. And an unhealthy diet, a diet filled with high cholesterol foods, a diet filled with high foods that are high in saturated fats, also increase your cholesterol levels. Then those cholesterol levels then in turn may over time lead to ASCVD. Interestingly enough, your family history also plays a role in terms of your risk for ASCVD. There are certain genes that we all carry within our families, but there's one disorder that's been directly linked to inherited cholesterol disorders, and that disorder is called familial hypercholesterolemia. So that's a gene that's carried in certain families that then in turn causes excessively high cholesterol in some families. And so that means that your family history is very important to share with your clinician when you're going to the doctor to talk about what has happened in your family, whether there's family history of high cholesterol, family history of heart disease, hypertension, diabetes, and other things, because it does play a role in that. Also, certain inflammatory diseases like rheumatoid arthritis and psoriasis can cause a high level of inflammation, and that can end up irritating your blood vessels, which then could lead to plaque buildup in those vessels that we showed in the picture. And finally, as we advance in age, advancing in age also is a risk factor for ASCVD. For men, it's for greater than 45, and for women, ages greater than 55 have a higher risk of risk factors for ASCVD. Next slide. So it's extremely key to be tested if you have any or several of those risk factors that we mentioned below, to be tested for ASCVD or to be assessed to see, do you in fact have plaque buildup and high cholesterol buildup within your coronary arteries? Because the outcome, like we shared, can lead to a whole host of diseases that could be prevented should you know in advance if you in fact have ASCVD. So it always starts with a good history and physical exam with your clinician. And so it's important to work with your doctor so that she can understand your history in terms of all of your medical history, but your social history too, in terms of whether you smoke or drink, and other things. And your family history is important because some of this is caused by genetic factors that lead to cholesterolemia. Then, of course, the physical exam, he or she will listen to your heart and your lungs and do other tests, examining your limbs and other things to see if there are any signs or symptoms of ASCVD. But that's really, really important to have a good history and physical exam by a clinician. Also, she or he will run blood tests. They can check your cholesterol levels, your triglyceride levels, your blood sugar levels is imperative to hear because we know that cholesterol and triglycerides are risk factors, and blood sugar relates to diabetes, whether or not you have it, whether or not that diabetes is kept under control, or if you don't have it or you may have it and not know it, that test will show you, do I indeed have diabetes or am I pre-diabetic? So checking those levels is imperative. Of course, checking your EKG, electrocardiogram, doing some heart imaging tests. They may decide to do that, where they look at whether there are problems with blood flow in the heart or in the coronary arteries. And so there's several heart imaging tests that can be done. There's the angiography that can check the arteries in your heart, in your neck, in your brain, and other areas of your body. Cardiac MRI really looks at whether there's some tissue damage or problems with blood flow in your heart or coronary arteries. They could do a PET scan, a cardiac PET scan, which is really assessing the blood flow through the small vessels of your heart, which is very important. They can do a CT scan of your heart to see the size of your arteries, to see, if there is any damage to those arteries within the heart. There's a whole host of these imaging tests. The list just goes on, but many of them are quite specific and sensitive to this type of disease and can help in terms of early diagnostic factors. Clearly, you might have heard of a stress test too. A cardiac stress test is important in one way to sort of unpack or reveal if you have ASCVD. A stress test really measures how healthy your heart is and how well it works under stress or the stress of physical stress of exercise. So that could be one avenue that your physician might explore. There's another test called the ankle brachial index, and that really does show or helps a clinician to figure out if you have a diagnosis of peripheral artery disease, and that would be artery disease in your limbs. Usually it shows up, ankles, legs, and feet. And so they're able to measure and look at that blood flow there to make that diagnosis. And finally, the last two are coronary artery calcium. There is a CT scan that clinicians can do, which is a wonderful test, and especially in diagnosing ASCVD, because this CT scan measures the calcified plaques, first identifies and measures calcified plaques within your coronary arteries. And so knowing that is really a gold standard and a diagnostic tool that works very well to see, do you indeed have that? But there are a whole host of things that can be done before that occurs. And finally, there is a risk calculator called an ASCVD risk calculator. We're going to go into a little more detail later about the risk calculator, but this is an assessment tool that really helps clinicians and patients work together to assess your over lifetime risk of developing ASCVD, but it also can determine or help to estimate your 10-year risk of developing ASCVD. So those are a whole host of tools, resources, and diagnostic measures that clinicians can use to work with you to examine and determine, do you in fact have ASCVD? But those tests can also be used to help you to look at maintaining, if you do have it, to monitoring your ASCVD if in fact you do have it. Next slide. So I mentioned the cholesterol panel and the triglycerides, and I just wanted to go over those values because it's so imperative. And this really is the baseline for what is really causing the buildup of plaque. It's the cholesterol, triglycerides, and the calcium buildup. And so what we have here, according to this chart from Mayo Clinic and National Library of Medicine, you have to the far left that shows you the ideal amounts in green, borderline in yellow, and too high or too low in red or orange. And so for your total cholesterol, ideally, your total cholesterol, you want a total cholesterol less than 200. And you want an LDL, or that's the bad cholesterol, if you will, less than 100. And an HDL, which is the good cholesterol, greater than 60, and triglycerides less than 150. So that's in the ideal world. That's the North Star. That's what we target to get to for our cholesterol levels, as well as for our triglyceride levels. But you can see the middle line shows you borderline. And this is where clinicians will work with you to think through as your other risk factors, as well as these values upon your blood test, as to how they're going to treat or what they're going to recommend. So your total cholesterol borderline would be, less than 239 or 200 to 239. And LDL, the bad cholesterol, borderline is 130 to 159. HDL, it differs for women and men. The good cholesterol differs for women and men. Women are borderline at 40 to 59 a value, and men are borderline at 50 to 59. So in triglycerides, you can see 150 to 199. So those are all borderline. And it's really at that stage where you can work with your clinicians to decide then what manner of treatment, if you're borderline, are you going to use? Some might suggest preventative measures such as, your lifestyle changes, and we'll talk a bit about that. And depending what other factors, risk factors you have, they may want to start drugs like statins or something else to help treat it. And of course, the high values or too high, or extremely high, or very high are listed there too. And so a total cholesterol over 240 is very high according to the standards. And so you'll really be working with your clinician to get that total cholesterol down. Also then subsequently to reduce the bad cholesterol, your LDL, hopefully to bump up your good cholesterol, your HDL, and to lower your triglycerides. So you can see those ranges there. Next slide. Okay, so lowering your risk for ASCVD is very important. And I just found this one picture that kind of sums it up in a nutshell of all the things that you can do to work with your doctor to lower your risk, and some of which I'm hoping you're already doing, and looking at. So things like all of these really do correspond to the risk factors. And so it makes sense. Starting with cholesterol there, assessing your ASCVD risk. And so there's that risk calculator that is a wonderful tool that you can talk with your physician about in terms of assessing your risk, but also to discuss with him or her whether or not you need medications to assist you to lower your cholesterol. But the obvious piece here is to have your blood checked for cholesterol, to get that cholesterol panel and to get that triglyceride value to know exactly where you stand in terms of your cholesterol level. lowering your blood pressure if you have high blood pressure, or maintaining a blood pressure that is in a healthy range. You really want the North Star there is 120/80, but keeping it below 130/80 is still recommended. And so maintain a healthy blood pressure is very important. Engaging in physical activity is extremely important. And this is really about aerobic activity. So walking, running, jogging, things like that. And what's recommended is some moderate physical activity, about 150 minutes a week of moderate physical activity. That would be like, you could probably do 5 days a week of something, or 4 days a week of exercise to get your 150 minutes in. If you want to do something more vigorous or physical activity, maybe more running would be in that category, it would be about 75 minutes per week. And that can just be broken up over several days, not all at one time. In some instances, aspirin use has been a primary prevention measure. It's really now reserved for just certain select high-risk patients. And so that would be a conversation to have with your doctor to determine, is this something that I need to do in terms of preventing to prevent ASCVD? Of course, if you've been diagnosed with type 2 diabetes, controlling your diabetes, controlling those blood sugars through diet, exercise, and in some instances, medications. Here they share like metformin, which is a primary therapy for diabetes, but others also work in terms of lowering your blood sugar. But what's so important here is maintaining or controlling your blood sugar and maintaining that blood sugar, because as we shared before, the diabetes then actually over time really can impact the lining of your arteries, especially your coronary arteries. So it's so important to have your diabetes in control. Be tested for diabetes if you don't have it, to see if you're pre-diabetic, especially if it runs in your family. Of course, your diet we shared is so important. Eating a healthy diet, fruits, vegetables, whole grains, nuts, omega-3 meats and things is very important. Keeping a healthy diet is extremely important. It also aids in your cholesterol, your blood pressure, and your diabetes. And finally, tobacco, smoking tobacco, or even lots of exposure to secondhand smoke really does impact the lining of your arteries, causing disruption there, and can over time lead to more plaque buildup. So as a physician, I always recommend not smoking. And if you do, to work with your physician to see how can I, in fact, quit smoking or at least cut it down. Okay, next slide. So if you have ASCVD, if you've had some of those tests and you've been diagnosed with it, it's important to manage it, and it can be managed. And so having or living a healthy lifestyle, a heart healthy lifestyle, is just imperative, not only to preventing ASCVD, but to treating the plaque buildup over your lifetime. We talked just in the slide before about all of these factors here: having a heart healthy diet, being physically active, aiming for and maintaining a healthy weight, quitting smoking if you smoke. I'll add to that list managing stress and getting good quality sleep. As adults, as we get older, we require and need more sleep. And so getting at least 7 to 8 hours, especially adults over the age of 20, 7 to 8 hours of sleep is very important. It helps your body to refuel, and it aids in healing, and it aids in being healthy. And so it's quite important to do all of this heart healthy lifestyle. I can't stress that enough. But when there are times when a heart healthy lifestyle in and of itself or by itself doesn't work just by itself. So medicines can help to manage your risk factors as well as treat your your ASCVD should you have it. And so certain medicines, since hypertension is a risk factor for ASCVD, medicines to lower your blood pressure will be essential to be able to take and to take them consistently. So finding that right regimen of anti-hypertension medicines is extremely important. But on our part as patients, to take our medicines consistently is going to be very key for all the reasons we've already discussed. Of course, lowering your cholesterol, should you be diagnosed with ASCVD, is paramount. This is the key piece here to this, to managing your ASCVD, is lowering your cholesterol. And so there are a couple of two groups of medicines we'll talk a little bit about today. One is statins, which is the first line treatment for lowering cholesterol in most patients. And we'll also talk a little bit about PCSK9 inhibitors. Both of those classes of drugs work to lower your cholesterol levels. And finally, as you shouldn't be a surprise, controlling your diabetes. And I've kind of like shared this quite a bit. Controlling and treating your diabetes, and this takes consistency too, both through diet, exercise, but also through whatever medicines your clinician has prescribed, whether it be metformin or whatever cocktail of medicines they've used to help you to control your diabetes, and checking your blood sugars with consistency is so key. And so taking those medicines in conjunction with a heart-healthy lifestyle really is the key to managing ASCVD in all populations, but especially in Black and African American and older adults. Okay, next slide. So in managing ASCVD, I mentioned two groups of medicines that clinicians can work with you to have if you're diagnosed. And the first of which is statins. Statin is a long tried and true classification of drugs. It's been the first line therapy after lifestyle changes for high cholesterol and ASCVD because it lowers cholesterol, which in turn helps to prevent cardiovascular disease. This is a group of drugs that's been tested and used over many, many years. And so the way this set of drugs works is it blocks an enzyme called HMG-CoA reductase, and to reduce the amount of cholesterol that your liver makes. So your liver has that enzyme, and this drug blocks that, and it helps to reduce the amount of cholesterol that your liver even produces it. So we're stopping with a statin, you're stopping or reducing that cholesterol from production. And so very effective class and set of drugs. It also works by helping your body to not only reduce the production, but to reabsorb cholesterol that's been sort of built up and gathered in the walls of your blood vessels. And so these drugs have proven to be quite effective. In fact, they have shown in populations to reduce the risk of stroke, reduce the risk of heart attack and other heart disease and cardiovascular disease by more than 25% in many populations. And so this is a first-line therapy after lifestyle changes alone that many clinicians will use in conjunction with your lifestyle changes to help to lower your cholesterol. There's a whole host of statins, different drugs out there that fall into this category, Lipitor, Cholestyramine, and many others. And so this is a good place to chat with your clinician too about, should you need medicines, might this be a class of drug that works for you, that'll work? And, and they're able to share that information with you. Next slide, please. The second group of medicines that we'll talk about are PCSK9 inhibitors. And so this is an interesting class of drugs. It's a newer class of drugs, much newer than, of course, the statins, which have been around for quite a while. This new class of drugs is only considered in 2 instances. It's considered in persons with high risk for cardiovascular disease and a cholesterol that's not controlled with statins or other cholesterol lowering drugs. And so these are for patients who at a high risk for heart disease, and they've tried statins or statins with another drug that lowers cholesterol, and it hasn't worked. And this is where the PCSK9 inhibitor comes in, because it's a class of drugs, of which there are 2 drugs within this right now in the market that can actually help to lower the cholesterol. And so it's kind of like a second or third line of treatment that might be tried. The other instance where clinicians consider this drug is for persons who have the genetic condition familial hypercholesterolemia, which always involves an extremely high level of cholesterol, and it's genetic. And so, which was one of the risk factors, having that family history of this genetic condition. This is one where a PCSK9 inhibitor is maybe indicated for use in patients who have that, and their cholesterols haven't been impacted or maintained by statins along with other drugs. And so it's these drugs have been just around for a few years. Interestingly enough, while statins are given by mouth, they're pills, sometimes they're large pills, but they're given by mouth. This is given by injection. These inhibitors are given by injection. One thing to note, they are more expensive than statins, but many insurances will cover, some of these drugs as well. And so they work by reducing the amount of this particular enzyme, the PCSK9, in your body to allow your body to remove cholesterol more efficiently. And so it's a great class of drugs, but it's just considered for 2 types of patients, essentially given by injection, but they're quite effective when given in those populations. Next slide. So it's really important, and I've been saying this not just because I'm a doctor, but it really is important to talk to your doctor to assess your risk for ASCVD. I can't stress that enough, especially if you have any of the risk factors that we shared earlier in the presentation: high blood pressure, diabetes, high cholesterol, family history. Obesity should be tossed in there as well. A long history of tobacco use, and other things. And so it's extremely important to assess your risk and have a conversation with your doctor about your risk for ASCVD. And, perhaps if he or she may want to then check to see if you indeed have high cholesterol, or especially if you have other risk factors. And so talking with your clinician about your lifestyle habits, and this is really where that history, I stress so much, that history and physical exam is so important. Talking to your clinician about your lifestyle habits, and that's part of your history. I was like, that's your social history, whether you smoke or vape, or what's your physical activity like, what's your eating habits like, and to be honest about that, to share that openly and honestly, to talk with them about your personal history, and that's previous and current medical conditions that really may be impacting your risk for ASCVD. So important, as I've tried to stress here, your family history is so imperative to know your family history, or at least to share your family history with your doctor, and to also share and to talk about, I'm sorry, these things, your risk, talking about your risk over the next 10 years, and talking about your lifetime risks for ASCVD. And that's where the ASCVD calculator app comes into play. And we're going to talk about that in just a second. And finally, talking with your doctor too about whether or not there are some preventative medications that you could take along with changing your lifestyle in terms of if you have ASCVD or if you're at high risk for it. And so those are all things that are so imperative to have that conversation. Well, the ASCVD calculator that I mentioned before is an app that really does help to assess your risk, and it's based on your personal data. And so what this app does, or this calculator app does, it estimates your risk over the next 10 years. And there is one that can estimate your risk throughout your lifetime based upon your data. So they ask in the app your demographic information, age, weight, height, blood pressure, and other factors in there. And once you input all of the information, the tool then shows what your relative risk is over the course of the next 10 years, but what your relative risk for ASCVD is for your lifetime. And it'll show as your risk could be at a low risk, a borderline risk, an intermediate risk, or a high risk. And this tool is a great jumping off point for a conversation with your doctor. And so if you don't know about the tool or how to access it, I have a link at the end of the slides on that. There's several versions of this, or having a using that to have a conversation. I'm sorry, the chat's distracting. Can't see the having that conversation with your doctor about the results of that risk from the calculator. Okay, next slide. I think this is the final slide. So in talking to your doctor, so here's kind of how the conversation, or what the flow of the thoughts go in terms of that conversation with your doctor. After the jumping point could be this risk calculator. And after you've done your risk calculator, this estimate here shows your relative risk over 10 years. You see the low risk, your results would show less than 5% risk from the calculator. Borderline risk would be anywhere from 5 to 7.5%. Intermediate risk would be like 7.5 to 20%, and high risk would be greater than 20%. And so depending on where you fall within that, you have the patient as well and the doctor together would have this conversation to talk about what are some of the risk enhancing factors that are present in your life. What are some of the means that we could work together to decrease those factors, and what might be the benefit of therapy. And that would be drug therapy along with a lifestyle modification. And so you can see typically for low risk, it kind of just goes straight down to lifestyle modification or maintaining even what you're doing, eating healthy, getting physical activity as recommended, not smoking, lowering your weight or maintaining a healthy weight is important. You can see for borderline risk, still having that conversation, depending on what other risk factors you have, it might just be maintaining a lifestyle modification, or it could lead to a lifestyle modification as well as drug therapy. But what's in the middle there is sometimes clinicians, if you don't know, or if there is some uncertainty as to what should be done for borderline and intermediate risk, they might consider doing a coronary artery calcium test, which we mentioned as one of those tests, and getting a score for that. It was one of those tests that's a CT scan that does measure the amount of calcified plaque that's built up in your arteries. And so this is so important because, as we have shared at the top of the presentation, it is these plaques that leads to atherosclerotic cardiovascular disease and leads to things such as heart attacks, strokes, and other diseases and conditions. And so having that test is really a wonderful biomarker or predictor for ASCVD risk. It's safe, it's non-invasive, it's relatively inexpensive. It's a CT scan, so it's not invasive. Everyone doesn't need to have this test, but actually sometimes when you're in the borderline intermediate risk area. And sometimes if a statin or other drug might not have worked, having this test helps to see just how much buildup or how much calcium buildup we have in our plaques. Of course, if you're high risk, over 20%, then it's a no-brainer. Essentially, it's what we've shared here is lifestyle changes, a heart healthy lifestyle, but also drug therapy. And so there's no question there, whether then if it's a statin along with another cholesterol lowering drug and or a PCSK9 inhibitor drug might be the option or drugs of choice. So the key here, I hope you've gotten the key takeaways in this, and I hope they've helped you today to think through how vitally important it is for us in the Black community, African American community, to really understand our risk for ASCVD, understand that there is a genetic component to this disease or condition, but that this condition can be managed through heart healthy lifestyle, depending on how high your risk is and what other conditions you might have, but how important it is that it kind of all works together, where managing and understanding and knowing our diabetes status, whether we're diabetic, pre-diabetic, and changing our lifestyles and habits to maintain and control our diabetes, lowering or maintaining a healthy blood pressure, knowing what your cholesterol level panel shows, knowing what your triglyceride level is vitally important. And so being armed with this information and then doing things to lower it that we discussed, such as, again, heart healthy diets, exercise, quitting smoking, managing stress, getting a proper amount of sleep, all of that, and potentially working with your clinician to start drug therapy like a statin. And so all of these things are so important, but the take-home message is that this does not have to end badly. Like these things can be caught early. We can get tested for them, and there's a lot of things that we can do and be empowered as patients and empowered as persons in our community to live healthy lives. And so I hope we've shared some things with you today that would assist you in living a healthy life, especially in terms of understanding ASCVD. And on the last slide, Angela, will be there's a final slide. Well, there's a final slide, they can share it with you, that has some resources in terms of getting more information about ASCVD. Of course, the American Heart Association, of course, has quite a bit of information on ASCVD and atherosclerosis, as well as I put in a link or information about the ASCVD risk calculator. The Cleveland Clinic has that. Other sources have information about that. Your clinician will have information about where and how you can get that app to assess your risk for ASCVD, both over 10 years and as well as over a lifetime. And of course, I think I had the national, the NIH, there's information there as well on the calculator for ASCVD, but also lots of information on ASCVD risk factors, how to treat those, a lot of information on statins and other drugs, and so a whole host of information. And so the link is in that last slide as well. So thank you so much. If there's questions, we have a few minutes, and she's here.
Hi, Dr. Johnson. Thank you very much for such a thoughtful presentation. Looks like we've had a hiccup with our technology, but we will certainly get those resources out to our audience. Thank you again, and many thanks to Amgen for sponsoring this conversation. Looks like we have some great questions in the chat, and I'd like to share them with you if I can.
Sure.
Good. All right. So thank you. The first question reads, during my annual physical, my doctor runs a lot of tests. Is my doctor testing me for ASCVD, or do I need to request an ASCVD test?
Well, usually in a comprehensive physical, at minimum, of the test for ASCVD, most clinicians are running a cholesterol panel. So they're taking your blood to check your cholesterol. If not, now you know to ask for that. Most of the time in a comprehensive physical, they're doing an EKG just to check the status of your heart, the heart rate. It shows quite a few things. So that would be included there. Probably checking if they're testing your blood, they're probably checking your triglyceride level as well. They should be doing a panel to check your blood sugar as well to see if you're diabetic or pre-diabetic. So most of the time, at least those two things that are tests or could be assessors for ASCVD. They won't make the diagnosis, but they could lead you along that path. Usually you're done in a history of your comprehensive physical exam. But what I always say and think about is go and armed yourself and ask, if you have risk factors that we've talked about, ask your clinician, should I be checked for ASCVD, for that type of heart disease? And share with them, if you know it, your family history or why you might have concerns about it. If there's, anything that would indicate that. And even if there's not, if you just want peace of mind and to be checked, you could mention that to your clinicians. I think that's a wonderful launching point. I don't know any physician that would say, no, let's not, who would be against that? They probably like hug you and say, yes, and so certainly, but don't make the assumption that things are being done in your care and treatment. If you don't know, ask if they are and what's being checked in your physical. And if not, then could I have, or I would like to have my cholesterol checked, or I'd love to have my blood sugar check. These are things that are standard, but in case it's not, go ahead and check and it'll give you some peace of mind.
Thank you. The next question reads, what happens when I don't know my family history?
Well, and we don't always know. And typically, what they're aiming for is that immediate family. And sometimes we don't know, parents and sometimes grandparents or things like that. And sometimes we just don't know. Generally, then there are so many, as I shared, so many other tests or ways to assess ASCVD that the family history, if you don't know, would not be a barrier to them making the diagnosis if they needed to make the diagnosis. They could also, and the main reason for it is because of that genetic factor for familial hypercholesterolemia. But if you have a cholesterol off the charts, and I shared the slide about how high that is, they could test for it, or in fact, they may not, and just treat you for that high cholesterol. And so it should not ever be an impediment to, getting assessed for it. But if it's helpful, if you don't, there are other tests. There's I probably listed about 10 things up there that could be done to assess you for ASCVD.
And Dr. Johnson, are there any symptoms that we might feel before getting to the doctor that would be triggers or should alert us, I need to go see my doctor?
Sure. And which are usually the symptoms for some of the major conditions associated with ASCVD. So like heart attack. So you could have chest pain or angina, shortness of breath, especially shortness of breath or chest pain at rest, or even just with exertion, climbing the stairs and feeling winded sometimes could be associated with it. There's this ASCVD not limited to the heart, but this atherosclerosis is not just limited to the heart while we're focusing on the heart, but it also impacts your extremities, your legs, arms, feet. And so sometimes having swelling there or numbness or tingling or lack of sensation in your feet or lower legs, lots of swelling there can be an indication or a symptom of a bigger heart issue or a lung problem. And so those kinds of symptoms definitely, if you had symptoms of a TIA or what they call a mini stroke, where you lost time, you don't remember certain things, or you have some numbness or some in your face, hands, arms, anywhere, lower legs or anything, you might have had a mini stroke or a TIA. It'd be something to make sure you get checked. If you've had slurring of speech or, or changes in memory, things like that. The symptoms are so far and wide because the conditions associated with atherosclerosis are so broad that there are a whole host of things. But the big things really are if you're having symptoms of a heart attack or a stroke or have had such, so that's a reason to seek urgent emergent care, and or if you have an upcoming appointment, to mention those things to your doctor. And so just not being able to walk as far, you can, sometimes it's subtle, but the big ones, of course, are chest pain. It doesn't always show up like that, but or shortness of breath. Sometimes it's arm pain, especially in women. And unfortunately, there aren't really many symptoms sometimes associated with just having high cholesterol. And it's like the silent killer, and which is why I'm glad the person who asked, is that included in my physical exam? Well, if it's not and you have a concern, yes, it should be included in that exam. And so asking your doctor to check your cholesterol, because there are not just symptoms that go, oh, that's a symptom of high cholesterol. It always shows up because it goes to the next level. It leads to heart attack. It leads to stroke and other things. And so that's why it's important to have that checked.
Okay. And if I may ask a part 2 to that question, is ASCVD more prominent in menopausal and postmenopausal women, or does it not matter?
That's a good question. I have not seen that it's more prevalent in any of those, but I will tell you it is associated with women who have had preeclampsia during childbirth, and that's like extremely high blood pressure caused by pregnancy. There is some association there. I've not seen anything about menopausal, postmenopausal, or pre. It doesn't mean it's just that I'm not familiar with that.
Okay, yeah. Thank you. And we have time for a few more questions, so I'm going to go back to the chat. Had a conversation with my doctor due to risk factors and history. I had a heart calcium score image and a treadmill stress test. Scored a 3, placing me in a 50th percentile with minimal evidence of CAD. Stress test was normal/negative. Question: is it possible to remove or eliminate current artery plaque, or is it more about preventing future buildup through medicine treatments and lifestyle changes?
The answer is about both. It's about decreasing plaque that's there, but in some instances, when that doesn't work, and I'll say this, it's about not adding more plaque to the plaque you have. In some instances, then when those arteries get to be too tight, and yours don't seem to be there yet based on the results of your test, but if they get to be too tight, should you keep going down the road and adding more plaque buildup to it, they may have to do something like insert a stent or something to actually open up that particular artery to cause blood to flow. The challenge too is that sometimes these plaques break off. And this is one type of stroke that happens when a plaque breaks free, and then it blocks those arteries, especially the ones to the brain, causing then a stroke, a special kind of stroke according to that. And so So the lifestyle changes that were recommended to you will lower the cholesterol, and in some instances can decrease the amount of plaque within those vessels, but it also will help there not to be an additional buildup of plaque that is associated with that.
Okay. Thank you, Dr. Johnson. And that's a perfect segue for the next question. As we approach spring and summer and more family gatherings, we want to watch our diets and so forth. So can you give us some ideas on what we should consume? What really is what does a healthy diet look like? And then part two, what are triglycerides? And where do they show up in our food?
So I'll start with triglycerides because they come from saturated fat, and they come from processed foods. So they're not in fresh vegetables and fresh fruits and fresh grains. So you know where they are? They're in all the stuff you like. They are
Oh,
in chips. So when you read the labels and it gives you the values for the saturated fat, that's where they're coming from. And so they're like in chips. um oh goodness, in so many processed foods, because they also help to maintain foods and they taste really good. That's the problem. I'm looking here for this one. I think it's called, I'm just gonna hold on. I think it's Choose My Plate. I don't want to say the wrong. Yeah. Okay. So one resource for healthy eating, I'll just put it in the chat for everyone. My plate. And I'll say it just in case you're not online list, So there's a resource called Choose My Plate, and it's actually government sponsored, and it's myplate.gov. Has excellent and they have a choose my plate. Oh, and there, hold on, there's another one too. A Choose My Plate. You can Google this. I'm sorry, doing typing with one hand because I'm holding my phone. They have resources, myplate.gov, or you could Google Choose My Plate, which is another site that really talks about really what is healthy eating. So, what Choose My Plate will tell you that if you look at your plate, half of that plate should be vegetables. I know. And not fried ones, and not cooked in fat back. I'm sorry, or or ham hock or any of that other stuff, where you're adding, thank you, adding fat to your meal. So that's where we don't want to do, and not overcooking them so that your greens are turned from green to brown. I mean, you want healthy. So healthy vegetables, all vegetables are good. So vegetables and fruit is good. There's some fruits that are better than others. The blueberries are an excellent, they're a superfood, a fruit. Strawberries are very good. Most of the berries are very good. But and if you're not diabetic, and if you are, you check with your doctor as to how much fruits you could have. But then whole grains are excellent. But things to avoid are all like the white sugar, the sugars, period, and the white floured things. And it's so tricky because sugar is in so many things. There's sugars in ketchup, it's in peanut butter. Sugar acts as a preservative. So it's in so much stuff that it's in most salad dressings. Like if you're just thinking you're eating ranch and it's just ranch and it's just not, it's got sugar in it. Some of the mustards and stuff. So a lot of the condiments have sugar in it. You have to watch that. The healthiest drink to drink is water. The healthiest drink to drink is water, not the carbonated one, not the one that says, that adds in an additive or fake sugar that you can't process, not the one with the Splenda and all of that, to make it taste good. Regular old filtered water is the best drink to drink. 64 ounces of water a day is a wonderful guideline. I try to drink 64 ounces to a gallon, but I don't have heart disease. And I'm not diabetic, but like 64 ounces is pretty safe for everybody. A day is very good. So things like that, to stay away from the fried stuff, stay away from the highly sugared stuff, stay away from all the processed foods. So like, if you shop the grocery store, shop the perimeter, not the middle aisles. And that's where you find, if you notice, the perimeter has your fresh meats, fresh vegetables all along the outside of the store, and the middle aisles have all the processed stuff. So many tips there. I'm not a nutritionist or a dietitian, but those are good resources that I recommend to friends, patients, and the like. Have lots of tips and things there. And I know the warmer weather is coming, but what an opportunity. Watermelon is an excellent fruit. It's sweet. It's got lots of water in it, great for your cookouts and stuff, and it goes along. I mean, things like that goes a long way, and then having healthier lean meats. I don't want to leave meat out. Healthier lean meats. So instead of getting the ground beef and making a burger with the 75 to 80% fat, try to get the 90% fat and have a little less. Have about 3 ounces of that. You don't need the biggest burger or the biggest steak. The lean meats are much better. Chicken is pretty good, especially organic. Eating the less fat pieces of chicken. I don't know, people like, the breast and the wing, the white meat typically, but you could eat the dark meat. It's not so bad for you, but there's less fat there in the white meat. So things like that, but stay away from the processed food, the hot dogs and the sausage. That is just innards of some animal. It is something fake, added with a lot of processed things, to make it taste good. They got lots of sugar in them too. So I hope that's helpful. But those resources there that they've typed into the chat are very good. There's a whole host of them online on resources that you can do for healthy eating.
Wow. Thank you, Dr.
I'm sorry if that was a big answer.
Not at all. Thank you. Thank you. Thank you. And we are exactly at 2:03, and we want to respect your time. We want to say thank you. This has been an awesome presentation. Lots to think about, great tools to approach our care provider. And we thank you very much. And we hope you will consider joining us again to further this conversation.
Thank you so much. It's been my pleasure. Thank you for inviting me. It's been my pleasure.
Very welcome. And to our audience, thank you for joining us. And again, thank you very much to Amgen for sponsoring such a terrific conversation. Thank you. And we give you back your afternoon.